Thank you everybody for joining the WARN webinar. We have a few more minutes before we'll be getting started. For those of you on YouTube Live, thank you for joining us as well. You'll be able to enter your chats and questions through the YouTube channel. For those that are able to connect via Zoom, we'll be utilizing the tools located inside the Zoom platform. Give us just a few moments and we will be getting started. Well, my clock says 1 o'clock and it is Wednesday, so that means it is time to get started with the COVID-19 WARN webinar. Thank you all for joining us. This is the 4th week of our weekly webinars, and we really appreciate all of you that are either attending for the first time or returning from having viewed a previous webinar. Today, we are connecting primarily through Zoom, and inside the Zoom platform, you have 2 methods in which to interact with the panelists and the speakers. You may either use the chat box or the question and answer. They're both located at the bottom bar on the toolbar. And if you would please, when you are chatting, please indicate that you will be chatting with all panelists and attendees by simply checking the box labeled 2 and then selecting all panelists and attendees, which is below. That allows not only the panelists themselves, but other people that are attending the webinar in listen-only mode to see the comments and questions that you post. If you have a specific question that you'd like to have the panelists either respond to throughout the call or potentially answer you after the webinar is concluded, you're welcome to use the question and answer box. Type your question in the center and then press send at the bottom, and the panelists will be able to read your question and answer it either in the webinar itself, or we do take those in which to create some frequently asked questions and develop content for future webinars. If you are unfortunately not able to log in by Zoom, but you can connect through YouTube Live, we appreciate you joining us. There's a chat box located on the right side of the YouTube channel. You're welcome to type your comments in there. I am monitoring that, and we'll get you an answer back as quickly as we can. And just so you know, today's webinar will be recorded. So what is being said here will be available after the webinar is over on our website. That is vawarn.org. And that is a post and a listing of all past webinars, the slides that we use, as well as the YouTube link. So please feel free to come back to this website frequently and get updated information. And with that, I'd like to turn it over to our presenters to get started.
Hello, everybody. I want to thank you for joining us for our Week 4 update. This is Ike. I'm one of the co-chairs for the Virginia WARN. On the webinar today, we have Tricia Henshaw with DPOR. She'll be speaking to us here in a little bit. We have Mike Ritchie with the Virginia Rural Water Association, who will also be speaking to us, giving us some updates. We have Mike Lynn, my co-chair for the Virginia Warren, and we have Scott Shirley, who's the incoming chair for the Warren, and then of course we have Geneva, who's kind of moderating us, keeping us on schedule here. All right. So again, I want to thank all of our partners that have joined us today, whether you're with a state agency, just calling to listen in. If you can keep us updated throughout the chat on anything that you hear that's of importance to you guys that you want to share with the group. Our WARN members, if you're not sure if you're a WARN member and you're on today, go to our WARN homepage, and Geneva will talk to this a little bit towards the end. Go to our Virginia WARN homepage, and we've listed all of our WARN members on the homepage there so you can see them. All of our Virginia utilities who have logged on, because this update is primarily for you, and this is the information that we have as of today, and any additional VA partners that are on, Virginia partners that are on, as far as consultants or those that are just trying to help the water industry be good stewards to our communities. We appreciate you guys being here. So our current situational report, I'm going to let Geneva talk about the EPA mask piece that she's been putting together. I know that her and Mike Lynn both have been receiving tons of emails about people requesting this. But the one thing I do want to point out on this is the EPA is putting their request in through FEMA, and as of yet, they have not gotten any official time when these requests will be filled. But we are still compiling that list so that we can have one mass ordering done through EPA, through FEMA, to get these masks together for the utilities. And what will happen is when these masks do come in, when these are finally filled, it'll go from the vendor to the utility itself. So you'll need to put in whether you're an owner or operator on these requests so we can get these to you. Geneva, do you want to speak any more on that? What your efforts are looking like on that?
Yeah, anyone that has not already sent me a request for masks, we are just compiling, again, like Ike said, a master spreadsheet. I would like to have the quantity of masks that you are asking for and the mailing or shipping address. Once they're received inside the state, we will be divvying them up into groups as best as we can to meet all the requests that we receive and sending them all out. We do not yet have an exact time frame, but as soon as we get that, I will be using the emails as they come in as the priority system, and then notifying you once they have been, once they arrive in Virginia and will be on their way to you. You'll get a second email to let you know that you should be expecting masks and how many we can send. So just use my email there that's on the screen and send me a request, and I'll keep them all in a master list.
Mike and Geneva, I would emphasize that we may get the masks. Due to the demand across the whole country, we may not get them. I just don't want anybody to think that they're going to be definitely coming. We're hoping and praying that we get to that point.
Correct. And that was Mike Lynn, for those of you that aren't sure who that was. That's our co-chair. So again, what we're trying to emphasize here is we are trying to put this request together, get it through EPA and EPA to FEMA. But at this time, there's no guarantee that request is going to get filled. So we do suggest that you keep using any other procurement avenues that you have. Like we talked about last week, and we'll talk about a little bit more as we get into, if you have any civil organizations that are willing to assist in making these, whether it's church groups, Boy Scouts, anything like that can help you out. And if you do find that you have extras or you have an extra resource, please share it. We'll talk a little bit on that too, because Geneva has created a spreadsheet on places where we can go to order some hand sanitizers and some other masks. Last week we had VDH that joined us on the webinar, and they talked about some of the things they're doing, as well as DEQ. At this time, we have no new updates from them. They're maintaining what they gave us last week. And if we do get updates, we'll definitely pass them on. I believe we have some VDH folks and DEQ folks on with us, and they'll post stuff in chat as we get questions. Okay. Here's our current VDH health map that we have around COVID-19. This was pulled at 10:30 this morning. VDH did notify us that they were not able to get all the numbers into this. They were having some glitches with their computer system, so these numbers are going to be a little bit higher than what's showing right now. But you can see as of 10:30 this morning, they're reporting 324 deaths, a little over 9,630 total cases in the Commonwealth, with roughly 1,500, almost 1,600 people in the hospital. So we anticipate these numbers will be a little bit higher by the close of business today. Here's our Institute for Health Metrics that we talk about every week, and you'll see that they're projecting the peak, the Virginia peak, to start about tomorrow, around April 23rd. Scott did a good job pulling this together for us on week one. Do you want to speak to this one, Scott?
Sure. As we've shared in the past, these numbers are updated frequently with the statistics from the health department. So they're updated in the mornings as well as in the evenings. The model assumes that we've seen a lot of discussions of states beginning to reopen. So the model makes certain assumptions, which is now noted when you use the website, about the continuance of existing policies. And so if policies change, we could see modifications in this. But as of now, as Ike mentioned, we're at a point where we're going to likely see the peak and then hopefully begin to see case counts come down, hopefully starting that trend towards day after day decreases. So as this would indicate, we're a good way into this. I think we're all probably appreciating the fact of seeing a model and realizing that we may be entering the backside.
All right. And one of the reasons that we felt it was important to include this in our slideshow is to really help utilities kind of work through their planning process, as Scott was talking to. And we have one question posted. Looks like Scott's going to answer that, but for the group that didn't get to see the question is, what is the recommended number of reusable masks for each person on staff? I would say at a minimum, you're looking for at least two, one to wear, one to clean. And if at all possible, you're probably looking, if you can do it through the procurement process, try and get 3 masks for everybody. So you have at least one to wear, one to clean, and one in reserve in case something happens. So if you guys get a chance to see what Scott posted there, you'll be able to.
Yeah, that's okay. Basically what we're doing, Ike, is we've targeted 3 masks per employee so they have an effective cleaning rotation.
Perfect. Okay. I believe that's going to take us into, we're going to start with DPOR with Tricia Henshaw, the Executive Director from Department of Professional and Occupational Regulation. And she's going to talk to us a little bit about some of what's going on with operator licensure and CEUs. Tricia?
Hi, Ike, everyone. Thank you for having me on. I'll give a few updates that I have, and of course, if there are any questions that I can answer or take back and figure out, which I'm doing a lot of nowadays, like everyone else, I'll definitely do that. Again, I'm with DPOR. I'm specifically with the Board for Waterworks and Wastewater Works Operators and On-Site Sewage System Professionals. So some of the information that I share today is going to be specific to our licensed operators, but then I do have some information that is that impacts all of the licensees under the department. So engineers, contractors, all the different licenses that are issued through DPOR. One big one that has actually just been finalized and made official in about the last hour is one of the issues, of course, that we've been dealing with that's been a big challenge, especially for the water and wastewater industry, is the ability for applicants to test. Obviously, when the executive order was issued by the governor, our testing centers also stopped testing. We shared concerns, and of course our agency director knows of concerns with various professions and occupations, but after I talked to Ike last week and he shared with me some of the kind of unique challenges in the water and wastewater industry and the potential public harm more than I even was aware of. I went back and shared that with our director, and whether it was because of that, I don't know, but I do know that she was able to get the support of her boss, which is the Secretary of Commerce and Trade in the governor's cabinet, and they were able to get the exam sites to reopen early. And so we are planning to start testing again on May 4th. Again, this was just finalized in the last 12 hours and made official an hour ago. So we're still working on the details, but again, the expectation is May 4th, people will be able to start testing again. There are going to be reduced numbers of people who can test at a time. Obviously, acknowledging social distancing, limitations on gatherings and all of that, it's probably going to be at about 50% of the normal testing capacity per exam site. And of course, they're going to be doing increased sanitation, any bioscreening, that they scan your fingerprints and stuff like that will be cleaned between each person and those types of things. But we are working on getting those updates out, and we'll update our website as we go forward. So that's kind of the big one that I wanted to share. A couple of other things that I wanted to share. Another one is that for the WUS board staff specifically, obviously our agency, as many people as possible, are teleworking and making alternative arrangements, just like the rest of the world right now. But for licensing functions, those cannot currently be done at home. And so we've had a lot of board staff and licensing staff that have had to continue to come to the office. In order to try and limit that as much as possible, we have temporarily reduced the call center hours between 8:30 and 1 o'clock. We'll be able to be responsive to email all day during our normal hours of 8:15 to 5, but just if you're trying to call right now, it is limited to 8:30 to 1, and I apologize for any inconvenience that creates, but of course my goal is to reduce staff time in the office as much as possible. And finally, I wanted to talk about a few waivers that were issued once the state of emergency was declared. When that happened, it included certain authorizations for agency heads to waive regulations that could be an impediment during the pandemic for our licensees. And so there were 3 that were identified that she was able to put in place immediately. One is to extend the expiration dates and the renewal and reinstatement dates of any licenses that would have otherwise expired, or their reinstatement period would have expired during the emergency. It's set to go 30 days past the end of the executive order. That's currently June 10th, so they'll all go through July 10th. But of course, that's subject to changes as there are changes in the emergency. Along with that, we also extended the exam eligibility deadline. So any exams that would have expired during the emergency period, the deadline is extended to 30 days past the end of the emergency declaration. And the final one is that she issued a waiver of any regulations that prohibit or limit online, electronic, or distance training, obviously acknowledging we don't want people getting together, and we certainly don't want to force people to get together because of a regulatory requirement that you have in classroom training and that type of thing. And so that was also immediately instituted so that people can take advantage of webinars like this and other distance training opportunities. So those are some of the big things that we have going on. If there are other things that I didn't think of or didn't cover, let me know. But those are the breaking news as of today.
All right. Well,
Thank you,
Tricia,
Tricia.
thank you.
Yeah.
Thank you for the update.
Go ahead, Scott.
Yeah, if anybody has any questions, again, you have the opportunity either through the chat function or the question and answer function to ask. We can circle back later and get Tricia to answer those questions, hopefully. Very timely,
Absolutely.
very good update. And Tricia, we appreciate the support to the water, wastewater agencies to keep licensed individuals in our ranks. So next up, we have an update from Virginia Rural Water Association, Mr. Mike Ritchie. Mike?
Mike Ritchie, just a quick thing that you may want to touch on is the Virginia Rural Water Conference. There is a question and answer about what's going to happen with that. So as you do your update, if you can kind of touch base on that too, appreciate it.
Sure will. Thank you for inviting me to participate on the panel today. I know we have quite a broad cross section of the water and wastewater industry on the call today. But for those who may not be familiar with Virginia Rural Water Association, we're a nonprofit affiliate of National Rural Water, and we provide training, technical assistance to eligible water and wastewater systems. And what that means is we generally focus on assisting small rural communities that serve populations of less than 10,000. So we differ a little bit from the large utility and service providers in that respect, but I think we share a whole lot of the same concerns and issues. In ordinary circumstances, I would say we would have our staff would be out in the field conducting on-site training, providing technical assistance. No doubt on a pretty day like this, we'd have folks out doing some leak detection and maybe smoke testing some sewer lines. Like everyone else, in response to the COVID-19 pandemic, we've changed the way that we're doing business. So since March, we've been limiting physical on-site visits to emergencies only. That's not only to protect your staff, keep us from possibly bringing the virus to your facility, but part of that strategy was to preserve our own staff, keep them healthy so that we can ensure that they'll be available for an emergency response if needed. If any of the smaller systems have a need, if you have water line breaks, leaks that you can't find, please give us a call. We'll evaluate, how critical it is. Please don't run out of water. We will get somebody out to help you find a leak. If it's just something minor, we'll put it on the list and get to you when things start to turn to normal again. Some of the ways that staff, they've been working from home, and so they're remotely reaching out to utilities on a daily basis by phone, email, and of course everyone's new best friend, Zoom. Some of the things, issues that we hear from operators and system personnel that they may have some concerns. They've been helping them, update emergency response plans, working on ensuring continuity of operations. One concern some of the operators have expressed is, they're short-staffed, and it's not necessarily, well, probably not from sickness necessarily, but kind of offsetting hours, and which it's a necessary thing to do, and I think it's a good strategy for systems to avoid infecting all their operators by cooping them up together. But it is there's some maintenance activities and so forth that probably have been delayed for a while, but they're going to work through that, and I'm sure everything necessary is going to get accomplished. There have been a few concerns about the PPE availability. I think Virginia Warren is doing a great job trying to put together a mask order. That's probably the biggest lack that I've been aware of. They're some of these smaller systems, they've gotten pretty creative in dealing with these issues, and I tip my hat to them. Some of the smaller communities, some of the civic groups, they've gotten together. They've been sewing masks and providing those to folks in their towns. Hand sanitizer, that's another one. I'm even hearing about some of these boutique distilleries. They've converted over, and they're meeting a need in their local communities as well. Feel really fortunate. I'm so happy that Tricia was on here today. A lot of the concerns that we hear talking to operators have to do with licensing and taking the exam. So really appreciate you, Tricia, and good work that your folks from DPOR have done. That's going to help out quite a bit. Thank you.
Thank you so much, Mike. I was so excited when I got the word, and I couldn't wait to share it, because I'm hoping that's going to be a help for people who are needing to get licenses and upgrades. So thank you.
It absolutely will. And of course, they're always scrambling for CPEs. We're so fortunate in Virginia by wrapping up a renewal cycle in February. I spoke with one of our sister organizations in Montana just a few days ago, and they're ending a renewal cycle in May. So they're really scrambling there. So kind of ahead of the game in that regard. But, there's CPEs are always a concern. So, I want to reassure everybody that we're still working to provide classes. So, there's going to be opportunities for that. I know a whole lot of operators, they do rely on our annual conference to come receive training and have those CPEs issued. We shouldn't be at conference today, actually, but, as we know, that didn't work out. We have rescheduled the conference. It will now be July 13th through 15th, still at the Hotel Roanoke. Everything remains the same other than the date. For those of you who had a room at the hotel under the old conference date, all those rooms were canceled. So you all need to reserve your room for the hotel. All the hotel or the conference registrations are just carried forward. So you do not have to re-register for the conference, but you do need to make sure that you have a room. We've been working on expanding our distance learning opportunities. And I know many of you have taken advantage of the classes that we've offered through Suncoast. I think we have 25 different courses that are available for that. But we've started holding webinars now. That's been new to us, and it was frankly, this was a good excuse to dive into that area. We've been needing to do that anyway. We also do a sustainable utility management workshop, and we've adapted that to do that in a video conference type format. So be watching our website for those class announcements. That's at vrwa.org. It's just about all I have. Some of you may have seen National Rural Water had sent, and we distributed a survey that was out last week, and the results of that are back. They all came back as a nationwide response. I don't have information specific to Virginia, but it's pretty interesting. I know AWWA did something similar. For those of you that are interested, we'll be posting a link to that on our website as well. And when you compare the dollar amounts, the projections between NRWA's survey and the one done by AWWA. Just keep in mind that, let's see what it is. I think 93% of the rural water respondents were those small systems that serve less than 10,000. So you're going to see a dollar loss, a cost discrepancy maybe between, the really small systems and the larger ones. Probably going to be up to us to try to figure out what that really means. But, the bottom line is that all utilities, no matter what size, have felt an effect as far as revenue loss. And, we're exploring ways to try to make that up. And I know we've all been somewhat involved on the legislative end of it, trying to bring that to the attention of Congress, and hopefully we can get some relief effort going in that regard. Overall, just speaking with different operators in the small systems, I'm always impressed with how resilient these folks are. They're some of these essential workforce that, on the front line we hear about a lot, but not in regard to water and wastewater folks. And they're kind of used to that, though. Frankly, they've never gotten the attention and respect that they deserved. But so I'll take this opportunity and thank each and every one of you for what you do each day. It's hard to wash your hands 20 times a day without water. Thank you very much. That's all I have.
All right, thank you, Mike. I just want to reiterate what Mike was saying there, that for the conference, make sure you reschedule your hotel room. The fee for the conference itself rolled forward, but you need to make sure your hotel room scheduled for that. We have a couple questions that posted in the Q&A. I'm gonna start with the first one. Aaron, I saw yours pop up too. I'll try and circle back to yours. But we have one here for Tricia. And her question is about the training that's going to begin May 4th with limited number of students who can sit for the exam. Did the Governor's Commerce Department point of contact indicate any guidelines regarding live training, and how many people can attend a training class if it's going to be that way?
Well, on May 4th is when the exam sites will reopen, so people will be able to take the exams beginning May 4th. And so there are already, the exam sites can accommodate different numbers just based on how many people take it at a given site typically. But my understanding is those numbers are going to be reduced by about half. Our agency has been working, representatives with our examination staff has been working with the exam vendors to make sure that all safety precautions are covered, which includes increased sanitation, includes limiting the number of people who can take it. So I believe that they're going to be ready to start taking scheduling for the exam in the next day or two. I think an announcement's getting ready to go on DPOR's website about it. So people who've been trying to get into the exam, it's probably going to fill up the few spots pretty quickly.
Okay. And Aaron, I see that Scott answered your question. Hopefully that gives you the answer you're looking for there. So if you guys have any more questions for Tricia and Mike Ritchie as they're on with us till the end of the webinar, or as close to the end of the webinar as they can be, we'll make sure we direct those questions as we go. Okay.
Ike, this may be with the question on live training, a good time to point out this webinar has been approved to be able to issue credits. And so attendees need to participate in the polling to show active engagement. And then at the conclusion, I'm sure Geneva will talk about it further, but that's one thing that we're pleased to be able to assist in this time where there's an absence of training opportunities for much staff that need to obtain their credits.
Absolutely. That's a good point. Speaking of which, do we want to go ahead and post the first polling question so people kind of get an idea of what it's going to look like?
Sure.
So this first polling questions is about operational changes, and we'll talk a little bit on this as we get in. But this is multiple choice. You can choose all those that apply to what your agency's doing or what your utility's doing. If you're doing something other, if you can post it in the chat so that we can all share it. But this is what are the best practices that you are using to help create a functional physical distance between your employees. One of them is rotating shifts, physical separation using multiple vehicles to get to a job site or other venues, occupancy limits, only allowing so many people into the operations room or somewhere else that you're doing business, remote monitoring so you don't have to have people on site as much, working only in the field, meaning they're not coming to the utility or to the office building to get their assignments. They're going straight from home out to the field and back, and they're just updating things electronically. And then how many do you have, or not how many do you have, but are you able to have a certain number working from home so you don't have to bring them into the office? So once those are answered, then we'll see where we are in our polling results. And all right, so 50% of you are doing rotating shifts. 69% of you are physically separating using different vehicles to get out to job sites. 57 are limiting your occupancy limits. 23% are doing some remote monitoring to help alleviate staff being on site. 21% are working only in the field, meaning they're going straight from home out. 70% of you have folks working from home, and then 4% are doing something else around trying to keep the physical distancing. And we started saying physical distancing instead of social distancing because we need to increase our physical space, but we all still really do need our social connections to get through this. Okay. Let's see.
There's one other question for Tricia, maybe before we jump off this portion.
Yes,
will
please.
all other DPOR testing resume 30 days after the end of the executive order?
This, not knowing how all the different boards work and licenses work in terms of their testing, I know some are just certain times a year and that type of thing. But in general, any exams that are offered by PSI, I know are covered through this, or where PSI is the vendor. And I think that's the majority of our professions and occupations. Otherwise, if there is a limitation on any other exam vendor, but I'm not aware of it, they were slated to restart on June 11th, so the day after the exam or the emergency declaration ended.
Okay. Thank you.
Sure.
Okay. Just wait for the next slide. Let me grab Robert's question here. So one of the things that one of the other folks posted is they're designating meeting areas in the facility for small groups. They report daily if staff is feeling fine or not. So basically, if they call ahead and make sure that their staff is doing okay before they have their staff arrive and start occupying. Mike, did you want to explain a little bit about, I know you talked about it last week, but did you want to explain a little bit about how you're doing your shifts for Mike Lynn?
Yes, we are staggering our shifts so that they come in at different times of the morning so that the smaller groups are out before the next group comes in. They're all working singularly in their vehicles, no two to a vehicle. If we're working on a water leak or a service tap that has to be made, we're trying to keep a social distancing as much as possible. They're using their own tools, and if they have to use common tools, they're all wearing latex or nitrile gloves to accomplish the task. And if they're working in a group together where they're going to be within 6 feet or less of each other, they're required to wear their mask.
Okay. Tricia, we have one more question about testing. So if somebody had applied to take the test prior to COVID, do they have to reapply to be able to take the test, or is their application already in the queue for next available?
Their application should be in the queue. So when we approve an application, it's good for a year. Any of those exam deadlines that happen during this emergency are automatically extended to 30 days beyond. Obviously, we're still evaluating other things, and we may do additional extensions since we understand there was a month of time or so taken out of being able to test. But right now, that's what's in place, that no exam eligibilities expired during the emergency. You have until July 10th, if it did.
Gotcha. And that's a question we have received a few times. So I think that's good for folks to hear, because a lot of them were wondering if they had to resubmit, if their submittal package was still good. So that's an excellent thing for us to hear. All right.
Good.
So we're going to move on to our warrant updates. And by all means, as we go on, if you still have questions for Mike Ritchie and Tricia, keep posting them, and we'll try to share them. If we don't get to all the questions today, we'll try to compile them and get them out to the group once we have the answers. Okay. So our warrant updates as of right now is we've not seen any requests come through warrant to facilitate anything. Pretty much everybody seems to be using this information sharing time on these Wednesday updates to get most of their needs met, but we haven't received any requests for any personnel, equipment, or other services at this time. Geneva, do you want to speak to this resource page that you've been working on?
We sure can. Please go check out the virginiawarn.org/resource page. I'm actually going to pull it over into the screen right now so everybody can see it. It does get updated virtually daily. There's a lot of new information out since our last webinar. So if you are looking for information, feel free to start here. As a resource, we have the potential suppliers list that we'll talk about in a little bit, has been uploaded. Some economic impacts that we'll discuss further on in the webinar are here, as well as just a variety of other things. There were some lab questions that came up last week. We've got more information about a lab finder, how to find different information. There was a question asked earlier in the webinar that we addressed offline about some researching for wastewater and wastewater treatment plants. Here at the very bottom is the link to that. So this website is extremely beneficial. It's here for your information, and please don't hesitate to come back every so often because the information is ever changing.
And I do want to reiterate that we've hung this on our forward-facing site. You do not have to be a WARN member to get to these links. Just visit our site, and we're trying to get that information out there for all utilities to be able to use as they need it. Okay. And our list of current WARN members, if you're not sure if you're a member or not, you go to that same site, and there's a link where you can see if you are a member or if you're not, because we've had people ask that they weren't sure if they were a member or not, so it is on there. Okay. Geneva, did you want to speak to that more? And at the end of our presentation, we'll have a thing in there for you to become a member. We'll talk you through the process. And you said you didn't have anything, Geneva? I'm sorry.
Nothing else to update. It is, it's being kept current. I have received 1 or 2 applications and contracts to join the membership since this originally started. So those have also been posted. Mm-hmm. And it is a current, as of we know it, list of members.
Mm-hmm. Awesome. And there are benefits to becoming a member. A lot of your MOU, MOA stuff is already hashed out as in your membership packet to make it easier for us to send resources between members. This doesn't mean that resources can't happen for non-members. It's a little more of a process that may take a little more time. So if you do find yourself in an emergency, just understand it will slow things down if you're not a WARN member. But we're doing everything we can to help bridge those gaps to make things keep flowing as smoothly as we can during this time. All right, so on our best practices, we talked a little bit about the VOSH site inspection. Scott, did you want to touch on that one more time for the new group?
Yeah, if anybody didn't hear the update last week, we had updated that VOSH has received approximately 165 site complaints. The important thing for utilities to understand, if you receive the complaint, it will be by telephone, and it's extremely important that the utility respond back in writing to send that on to VOSH to conclude the investigation. If that's not complete, VOSH current policy is to forward that on to local law enforcement. And so we just wanted to make sure all utilities were aware of that procedure in the event that you receive. Generally, these are driven by employee complaints, but if you receive one, ensure that you're responding properly in this time period where we saw the procedures everyone had of work from home, staff kind of distributed. So it's really important to make your management team aware that if somebody receives a contact like that, that you've got adequate procedures in place to make sure it gets to the appropriate management member who will respond.
Perfect. One of the other things that we talked about on best practices is making sure you're reviewing your continuity of operations plan, making updates to it as you're seeing this process go on with the COVID. Maybe you're seeing some things that need to be changed in there. And I hate to be the bearer of bad news. We are on the cusp of hurricane season, and CDC is saying there may be a second wave for COVID coming in the wintertime. So you definitely want to be looking at your emergency response plans, reviewing your continuity of operations plan, how you're going to maintain business as things degrade on you and get back into doing business. One of our key things here that we keep talking about is what are we doing to maintain employee morale? One of the things that came up was VDHODW is doing certificates of appreciation for those that employees and utilities through this time. All you got to do is make a request to your local field office, explain to them what you're trying to do as far as a certificate, and they'll process that for you. Making sure you're keeping your employees aware of their employee assistance program, where they can reach out together for a lot of mental health issues. People are more depressed. There are more things they want to air and get off their chest. Make sure those employee assistance programs are out there, and not just for the mental health things, but just other ways to keep them engaged. And then one of the things I always ask is, what is your utility doing? If you could share that with us between webinars, we're happy to post it here so other people can get some good ideas on what you're doing to keep your employees engaged and keep their morale up. We always try to talk a little bit about safety, especially with COVID going on. It's pretty easy for us to focus on our response to maintaining our medical readiness, but what are we doing to maintain our security? Whether this is around your IT cybersecurity or your physical security at the plants, what are we doing there? And then your safety issues. If you're moving two people around in a vehicle, are you making sure they're wearing safety glasses and a mask? They're in close proximity like that. Are you looking at your different safety and security postures? And I believe we have a poll question on that right now. Do we not, Geneva?
That's the question you're looking for?
That is the one. And I do apologize to everybody about the background noise. It's still at the op center here.
Do you mind reading the question for those that are on YouTube? They do not get the option of seeing it on their screen, but if you could read it, they'll at least be able to know what y'all are asking about.
I would love to. I'm working on my voice over radio. So the question that we have right now is about mask and glove wearing. It's, has your company, utility, or other entity mandated the wearing of face mask and nitrile gloves? And your choices are going to be yes, no, or not specified. And as soon as we have the answers,
taking a little bit longer.
We'll
Everybody's getting their calls in, but there we go. There's your results.
All right. So 32% of the people that answered the poll says yes, that their agency is mandating the wearing of mask or nitrile gloves. 53% are saying no, it's not mandated yet, and 15% say that it is not specified whether they have to wear them or not. Okay. And remember, we're kind of circle back to what Scott was saying about the BIOS stuff. So this might be one of those things that we do want to write something in our planning process around so that we're getting good information out to our employees. Okay.
Well, and Ike, I think it's worthwhile to note, all of our utility staff, we're all circulating in the communities we serve. And so we are beginning to see the transition for employers like Walmart that are making masks and requiring masks to be available for their employees. And so I think it's worthwhile for utilities to consider our staff are going to be seeing that. And we talk about managing morale. And so I know it has been a challenge. As Geneva pointed out, we've tried to help with some resources. Other utilities have been able to identify opportunities to order masks. That's something that you may want to consider, because ultimately, as we see this transition, I believe even the reopening guidelines emphasize use of masks in the phase one. And so if your agency hasn't done that, I would encourage you to have a good discussion internally about the potential and if you should adopt that moving forward as we begin to see more and more employers migrate to those requirements.
Perfect. And for the group, those that don't see the chat, Marty had just posted about that he has a distributor, or mentioned a distributor that can get bulk hand sanitizer, and he was informed that they can get these in 30-gallon commodities and possibly 5-gallon containers as well. And then Michael is asking, when will Virginia enter phase one? That's an excellent question. Scott, did you want to take that one? Because I'm going to defer to let's find out what the VDH guidelines are on the phase one. But go ahead, Scott.
Well, from the federal guidelines, you have to have 14 days of declining new case results. And so even this week, if we just take the raw federal requirements, this week we had a couple days of decline, but then we had the escalation in cases. And as I understand the federal guidelines, that's a reset. And so, again, it's going to take 14 days. Now, as also in the federal guidelines, some of what we're seeing, governors have the opportunity to consider areas of their state, county by county, if they choose, to look at those trends. And so Virginia, at least that we've seen, has not made any kind of announcement about how phase one we would expect. We'll all be seeing that sometime in the near future. But that's just from a federal guideline perspective. Obviously, we're at least, again, 2 weeks out. We didn't get the full case count today. But assuming if that started day one, you're still tracking for 14 required days under the federal guidelines.
Perfect. All right, and then Tricia, we have one more question that got posted in your lane here. It says, will D4 have an action plan in place should a second round of COVID occur over the winter, which may impact the 2021 license renewals? Are they considering an extension for those folks?
Obviously, it will depend on how things evolve. Like all of us, we are definitely learning through this process what types of things to get in place. So I would imagine that, yes, we will be working on an action plan to be more prepared next time. Hopefully this doesn't come around, but if there is an increase in the fall and winter. So I don't have a firm answer as to what that would look like, but I know
Yes,
we're
ma'am.
all talking internally to kind of get things in place.
Yeah, I believe at this point, being into this COVID, I think every agency is looking at reviewing their pandemic planning on how they're going to handle it. And even if there's a second round, it's going to be looking at that pandemic plan again and working off that checklist that'll come from that. So all right. Thank you, ma'am. Appreciate it.
Sure.
Okay. Move on to the next slide here. All right, so this is our slide on supply updates. These are the things that we ask every week. If anybody's seeing any plant supply impacts, we are seeing some supply chain impacts across the state. We've had people report that they've had to split their orders between several vendors to meet their needs. Others that have had to reduce the amount of items that they're ordering because they just can't get their supplies filled. And some of this is around field supplies, bleach for line repairs, the items that need to go in there for doing line repairs and maintenance. Obviously, employee supplies is still a big one, especially around masks. Hand sanitizers, we're still getting requests on hand sanitizers, and we're getting some good information that we're posting on our link about that. Marty just gave us another blurb about his supplier that can get the bulk hand sanitizers, and then surface cleaners. And then we're seeing that there are tertiary impacts, people not being able to come out and either maintain generators, forklifts, other plant equipment because they're just not going out and engaging right now because they're waiting for the all clear. So we're seeing other types of impacts. Does anybody want to weigh in on that? Mike, Scott?
Well, we did have a recent conversation with DEQ Revolving Loan Fund. They're beginning to see some impacts in capital projects. The primary area of delays that utilities are experiencing involve equipment startup. Oftentimes, the equipment manufacturers are coming from other states. Those states may have more stringent requirements on the lockdown, so they're unable to come to the job site to be able to complete required startup. And so that's something that we'll continue to track with DEQ Revolving Loan. They're obviously very connected in to some capital projects. We did have one of the participants share following last week's call. They were beginning to see some implications in their capital projects. So that's a good one to be aware of, depending on where you're at. I know we've got some projects in design phase. We hope and have seen some impacts, but obviously we're not towards the startup equipment install phase in the project for any of our large plant jobs. So something to be aware of, that if you have a progressing capital project, others are beginning to see impacts, and just be aware of that so that you can try to get out ahead of it and effectively communicate with your contractors and vendors.
I believe, Mike Lynn, you were talking about that too earlier, that you have some capital improvement projects because they're already in the works, they're going, but you have some new capital improvement projects that are kind of in that hold phase right now until you get some better guidelines.
The current projects that were already in the CIP grouping are still going. We've got a couple that we have not issued start orders yet because we can't get together and have everybody sign the documents. And all the contractors around here are so busy, some of them are glad that we're holding up on some projects.
Gotcha. We have one question in the Q&A. This will be to the entire group. Is anyone taking temperatures of workforce, such as workers who have completed their 14-day quarantine, and issues around thermometers? So if anybody wants to post anything in the chat on that, that'd be great. We can share that out. I believe we have another poll question that we can post right now, Geneva. Okay. So this is kind of around that flushing topic that we talked about last week, especially those areas that have been sitting dormant. Have you begun planning your flushing operations in your dormant areas impacted by COVID? This is another multiple choice. No, we haven't begun the planning. The second one is we're pre-planning. We've begun some of our mapping. Our third choice is mapping is complete. Our fourth choice is mapping is complete and flushing has begun. So as soon as we have that, and this is if we can go ahead and, I don't know if you can move to the next slide while the question's up.
Well, real briefly, I'll just touch on the fact this is what the supply vendor looks like. They're into some broad categories: hand sanitizer, lab testing, masks, and neck wraps that could be pulled up above the face to become also a mask. and then some PPE supplies. So this is what's available out on our website if you go take a look at it. And if anyone has additions to these items, if you've been able to successfully put in an order with someone or a vendor that you have that you'd be willing to share, please send that to me by email, geneva.hudgens@vaawwa, and we'll get this refreshed each week with new vendors as they become available to us.
Gotcha. And Marty, if you don't see yours on there, if you can make sure we get that again. And Sharon, I saw your posting about it does not apply for your wastewater choices. I totally understand. And then Michael is stating that they are screening their employees before they come into work. All right, so our answers on the flushing question, 55% no, or said no, they haven't begun their planning process yet. 25% are saying they are pre-planning and mapping already. 5% are saying they have completed their mapping. 17% have actually completed their mapping and have begun their flushing. And we talked about this question before we put it in there. We didn't want to say flushing is complete because we don't know the extent of how long we're going to be in some of those. So we don't want to say flushing is complete until we're actually back into full operation. So, all right. I appreciate everybody who took time and answered that question. It's good information. And if you do see the vendor list that Geneva put up, we did put all the quick links in there. All the hyperlinks are in there too. So our flushing process that we talked about, we just posted that question. We have some stuff on our Warm Set website about the Legionella mitigation, lead and copper issues. Michael is asking if anybody dealing with flushing at closed schools. And that was kind of, Michael, that was kind of part of why we asked that question, to get us start thinking about that. But he is asking if anybody's already dealing with that. If anybody can post in chat what they're doing around flushing at the schools. Because here we were also thinking about any shopping centers that may be dormant, places like that before people start occupying. And then also, if these places are identified as sheltering locations, should we have to do a hurricane shelter plan? Have we started flushing those areas also? Okay. All right. And then we'll move on to the next slide. So we were talking about the economic impact. So right now, AWWA estimates that just in the water industry that we're going to have a $32.7 billion economic hit just from this first round of COVID. Should we, I say first round, I'm going to knock on wood that we don't have a second, but should we have a second round, obviously these numbers are going to increase. So we're talking about, is there a need for a recovery fund? A lot of us believe that there is, and I would potentially say that hopefully your utility already had a recovery fund set aside or something that they can pull from a recovery fund. If not, that's something that we do need to take forward way past our level up to the national level to see if there's anything that may be pushed for that. And do you feel there'll be any long-term maintenance impacts? And this was a question that we were looking at as we're trying to do our physical distancing and we're trying to protect people. Which part of our maintenance program are we probably letting lax a little bit? We're trying to maintain our emergency calls and different things like that, trying to get to those pieces. But what about where we've had to let maintenance kind of, it's not broke, don't mess with it, because we don't want to put a lot of people there. What impact is that going to have once we're actually able to start getting back into the full swing of doing business? Michael's saying that right now they're having a hiring freeze around some things. Okay. All right. So one of the answers was we regularly work with schools, facilities, staff after every summer to flush. So we will work with them to do so when things open back up, which at this point is just going to look like a long summer, but it will be every school, not just the ones that didn't host summer activities. Okay. All right. Geneva, do you want to speak to this slide? Was that I think we have one more poll question too we need to post, right?
If you would like to do that poll question, it had to do with the sampling method. I don't know if for sake of time, we have time to ask that this week, or if we'll carry it over to next week. Which do you prefer?
We can take it to next week. We'll post it next
Okay.
week. Give everybody a teaser to come back on for next Wednesday.
There you go. Well, this next slide, and as we're wrapping up here, we know we're running over just a little bit, but if you'll bear with us, there's a couple of pieces of information we just want to share. One is how to become a member of the WARN. If you're not one of the existing WARN members that are listed on the website and your utility is interested, there's 3 pieces of information that are needed. A mutual aid agreement, which is a legal binding agreement designating a lot of the information in advance, all those legal issues that you get worked out prior to entering into an actual sharing of operators or supplies or whatever it may be. An adopted resolution, so this would need to go to a board level, be it local or service authority board, and be approved by the governing establishment. And then finally, an authorized representative form. So that is just simply letting us know who the appropriate people inside your utility are for interacting with the WARN, getting WARN communications, and responding to WARN communications. Last but not least, to get more information about all of those categories, you can go to our website, vawarn.org/members, and it will explain each one of those in a little bit more depth. One other item to add here is that this is a completely free program. It costs nothing to join, and there's no obligation. If you have a need arise, you can ask for assistance. If, however, the need is someone else's and you are not available or you don't have resources to share, that's not a problem. There's no obligation. It's just a large communication conduit, basically, that we can share with one another what's available and what might be needed. So please consider it if you're not a member. And then my next slide here has to do with continuing education credits. Thank you so much to DPOR for approving those credits for us for these webinars. If you're currently on the webinar now, I'm going to launch the truly final poll, which is if you are needing continuing education credits, it would be 1 hour. We can offer them for water operators, wastewater operators, engineers, or if you're in the category that you don't require training or training credits, you're welcome to say none or simply skip the poll. But this will be the indicator that lets us know that you need a transcript. We'll take the information that you logged into the website with and create that for you. So we do ask you give us a little bit of time, 1 to 2 weeks, we'll get those transcripts turned around. DPOR was also extremely gracious to say that any previously attended webinars, and those need to be live so that we have your interaction. We can see when you logged into the webinar and that you stayed for the duration and hopefully engaged with some of our polls and chat boxes. We can issue credits for any past attendance. In order to get a transcript for a past webinar, we ask that you send an email to scottsmith@vaawwa.org. He is our brand new training coordinator. I'm excited to have him on board so that he can take on this task while I'm taking care of some of the other items for the webinar. He can be working on transcripts. So divide and conquer, that's what we're all about. So with that, I'll turn it back over to our panelists and see if we have any remaining questions out there before we wrap up for today.
So I'm busy, as Geneva was talking, I was busy trying to type in some of these. Russ did bring up a good point I would like to touch before we send you all off. And Russ's point was, if I get back to it now, I gotta scroll up here. Well, now I can't find it. But basically what they're doing is because of what's going on with COVID, they're going to have to table their rate increases, which means they're going to have to absorb some more costs as they get back into operation. I would imagine there's some other utilities that are going to be out there having to do the same thing. So the answer to our poll question is 46% will be looking around water operators. 24% are going to be looking around wastewater operators, 23 for engineering, and 21 for none. And Lauren, I'm capturing your question too about if we can add a I don't know to some of these. We'll definitely look to add that to our poll questions so more people can participate in the answers. Okay. And if you do have any questions or anything comes to mind between now and the next webinar, or you can think of some points that we need to touch on more for you, please, by all means, email us. This is the list of your chairs and co-chairs and future chairs. Myself, Mike Lynn, Scott Shirley, and of course, Geneva. I know Geneva's email's been blowing up between the weeks and with everything COVID, but by all means, please feel free to reach out to us and we'll do our best to answer your questions or get answers for you and or get your topics into the next webinar. Mike, Scott, do you have anything you want to say? I know we're tight on time there.
I think you've covered it all. Thank you.
Yeah, thanks for those that attended.
All right. Erica, or if you're still on, I have Scott's email up right now, and it's Stephen.Shirley at West. Oh, go ahead. I'm sorry.
I'm thinking she wants Scott Smith, our newest training coordinator, since that's the slide that just got moved. So I've answered her question in the question and answer box. But yes, we have a Scott Shirley and we have a Scott Smith. So just like we've had two mics on the call, it's been a fun day.
All right. Thank you, Tricia. Thank you, Mike. I appreciate your guys' information. It was well received, I think, by our audience, and we look forward to seeing everybody next Wednesday.